Welcome, and thank you for joining us today. My name is Ellen Wilson, and I'll be the moderator for this expert briefing for the media, which is hosted by the Johns Hopkins Bloomberg School of Public Health. Today's briefing will provide an update on the current status of the COVID-19 pandemic. We'll discuss whether we're nearing its endgame in the US and how to get across the finish line, both here and globally, through vaccines, promising new antivirals, and outreach to vaccine-hesitant communities. Please note that participants are welcome to use images, video, or quotes directly from the briefing, and that the content is for immediate release. First, I'd like to briefly introduce our two speakers. Dr. David Dowdy is an associate professor of epidemiology at the Johns Hopkins Bloomberg School of Public Health and a physician with Baltimore Medical Services. He serves as the track director for infectious disease epidemiology at the Bloomberg School and has studied the epidemiology of multiple infectious diseases, including COVID-19, tuberculosis, and HIV. Dr. Rupali Limaye is a social and behavioral scientist and health communication scholar, widely seen as an expert in vaccine behavior and decision-making, including vaccine hesitancy and acceptance. She studies how health information can best be communicated to individuals in different contexts and through different channels. We will have time for questions following our speakers' remarks. The procedure will be as follows. We will take some questions that have been submitted in advance of the briefing and some from the Zoom chat. If you have a question during the briefing, you can enter it in the Zoom chat addressed to all panelists. Please enter your name, media outlet, and question. We hope to cover as many as possible. Just to note that participants will be muted during this briefing and it will be recorded. Dr. Dowdy, please go ahead.
Thanks so much for giving me the opportunity to speak today, Ellen. I'd like to give an update on the current status of the COVID-19 pandemic. After reaching a low point about 3 weeks ago, cases due to COVID-19 have started to rise again in the United States. Cases were falling consistently until mid-October, but over the last 3 weeks, cases have started to rise again in most states. Cases in Eastern and Central Europe have more than doubled during that time, meaning that the possibility of a winter surge here is very real. And vaccine effectiveness against infection is not as strong as it once was. Among people who were vaccinated early in the pandemic, vaccines may now only be preventing 2 out of every 3 possible infections. But even though cases are going up, vaccines remain highly effective against serious illness. Our most recent data suggests that vaccines still offer at least 80 to 85% protection against hospitalization and death. This protection has been solid and consistent over time. So even if cases go up this winter, we're very unlikely to see a return to the overcrowded ICUs and makeshift morgues of a year ago. These trends can help us make smart decisions for the upcoming holidays. Last year, even without vaccines, we didn't see major spikes of disease during holidays like Thanksgiving or Christmas. So if your family is fully vaccinated, getting together for the holidays this year is a reasonable choice, though it might be a good idea to get tested before you go and to stay home if you're feeling unwell. But if you live in an area of high transmission or have family members who are unvaccinated or have weak immune systems, it's also very reasonable to wait until things are a little safer to get together. Going forward, we're going to have to learn to be adaptable in our decisions. There is never going to be a pandemic mission accomplished day. We're likely to see local outbreaks and perhaps winter surges for many years, if not for our lifetimes. But as immunity builds up, cases of COVID-19 will likely get milder over time as well. So we're going to have to figure out as individuals and as a society how much risk we're willing to tolerate and how cautious we need to be as cases rise and fall in the future. But we shouldn't start talking about a COVID endgame until we've gotten a vaccine to everyone who's willing to get one. More than 1/3 of people in the US who haven't been vaccinated still say that they're still willing to get the shot. And more than half the world's population is still unvaccinated. So our #1 public health priority remains getting as many people fully vaccinated as possible. And I'd like to end on a note of cautious optimism. It's worth remembering where we were at this time last year. Many schools were not in person, many businesses were operating at partial capacity, and many gatherings had strict size limits. Yet COVID-19 cases were rising more than twice as fast as they are today. Now, we have extremely safe vaccines with long-lasting effectiveness against serious disease, oral antivirals that could soon make COVID-19 a highly treatable disease, and we're living our lives much more like in pre-pandemic times. And despite this, the COVID death rate in the US is still falling and is now only half of what it was 2 months ago. In summary, the world may never look like it did before the pandemic, and we may still be in for winter surges in cases this year. But from a COVID-19 perspective, there are many reasons to believe that things will be much better in 2022 than they have been for us these past 2 years. Thank you.
Thank you, Dr. Dowdy. Now we will hear from Dr. Limaye. Dr. Limaye, please go ahead.
Thank you so much for allowing me to be here today and comment. I primarily study vaccine behavior, and I want to make really 2 key points based on questions that I receive as a behavioral scientist. The first, I want to focus on the importance of vaccinating children, including those that are between the ages of 5 and 11. So many of you know, but about 2 weeks ago, an EUA was issued for the Pfizer vaccine for 5 to 11-year-olds. Vaccinating our children, specifically in that age range, can have immense benefits to reduce infection of others who may be at more risk. This includes grandparents that you may see at Thanksgiving, for example, teachers and other family members as well. Recent research indicates that vaccinating 5 to 11-year-olds is expected to prevent 600,000 infections over the next 4 months alone. The COVID-19 vaccine is recommended for children, even if they've had COVID-19 infection. And that's simply because the vaccine can better provide longer lasting protection than natural infection. It is safe and effective to receive the COVID-19 vaccine near or at the same time around other vaccines, such as, for example, HPV or influenza. General adverse events among those that are 5 to 11-year-olds were similar to what we saw in older children as well as adults. Essentially, pain at the injection site, some redness and some swelling and some soreness perhaps in the arm. While there was a small number of vaccinated young men in the older age cohort of 16 to 29 who developed myocarditis after receiving the adult dose of the vaccine, there were no cases of myocarditis identified in the 5 to 11-year-old vaccinated participants. The second key point that I want to make is that it's still important for us to continue to provide information to those who have not gotten vaccinated so that they can make an evidence-based decision. We continue to see vaccine hesitancy in specific populations here in the United States, and specifically with populations that have health disparities related to COVID morbidity as well as mortality. This is really due to a lack of confidence in the vaccine, perhaps concerns about safety, as well as a general distrust in government. As a result, I would argue that we need to get better at risk communication at different levels, not just public health entities that talk to the public. This is also why we spend a lot of time working with journalists. We need to provide context for any sort of data point that we use and make sure that we don't have sensational headlines and scare people. One thing that we have learned throughout this pandemic is that if we don't know the answer to something, having open, transparent communication is really the way that we're going to increase trust in the public health system as well as vaccines. One way that we can build this trust even further is by selecting and working with trusted community leaders to serve as these messengers to promote the vaccine or any other intervention related to COVID-19. We still need to continue to lower barriers related to access because there are populations that continue to have issues with access. And we need to think about ways in which we can find innovative approaches to incentivize vaccination, whether that be through food incentives or financial incentives, for example. In closing, I am hopeful that we can continue to work together to make sure that people are making evidence-based decisions with regards to vaccination and with COVID-19 behaviors in general. Thank you so much.
Thank you, Dr. Limaye. Now we will take questions. If you have a question, a reminder, please enter it in the Zoom chat with your name, media outlet, question and to whom you'd like to address your question. Here is the first question from Nick Tate of WebMD for Dr. Dowdy. What do the COVID trends in Europe and perhaps elsewhere tell us about the likelihood of a winter surge in the US?
Thanks, Nick, and this is a great question. I think that there's a general perception that things in Europe are much worse than they are here in the US. But the reality is that from a death perspective, things are very similar in Europe and the US today. Deaths are trending up in Europe and they're more flat here in the US. But for the past 3 months, unfortunately, mortality rates have been much higher here in the US than they have been in Europe. So we've paid a bit of a price here, but we probably also have a higher level of immunity to the virus. So while I do expect to see cases increasing, we've started to see this in the last week or two. I don't think that what we're seeing in Europe necessarily means that we're in for a huge surge of serious illness and death the way that we saw last year here in the States.
And as a follow-up, is there anything different this time around that gives us cause for optimism?
Great question, Ellen, and thanks for reminding me. Yes. So this time around, as opposed to last winter, we have highly effective and safe vaccines, new treatments that are coming on board, and a very high level of immunity in the population. So while we still are susceptible to getting cases of COVID-19, I think that the amount of serious illness and death is going to be much less, especially because of all the efforts that people have put into getting vaccinated and getting their families and communities vaccinated as well.
Here's a question from Jessica Glenza at The Guardian for Dr. Dowdy. It's similar. Should the US expect a fifth wave of COVID-19 infections, such as those currently impacting Europe? And if so, does that impact a COVID exit strategy?
Yeah, so again, I think we need to start thinking separately about cases and serious illness, such as hospitalizations and deaths. I do think that we are likely to see a fifth wave of infections. We're already starting to see cases uptick. How high that goes, I think is very difficult to predict. But that does not mean that we will necessarily see a fifth wave of death and overcrowded ICUs. I think anyone who says that they can predict the course of the pandemic for the next few months or few years has been proven wrong in the past and will probably be proven wrong in the future. None of us knows the future of this pandemic, but I do think that we are in for an increase of cases, not necessarily of deaths and serious illness.
Great. And so we're getting a lot of questions about how we'll determine when or if the pandemic is over and or transitions to endemic state. When the time comes, how can this message that COVID is going to be with us be appropriately communicated to the public? I'll start with you, Dr. Limaye, and Dr. Dowdy, if you could also comment.
Yeah, it's a really great question. And I think it's hard because I think the way this has been messaged in the past is that this is now the way out of COVID-19 pandemic. And now this is the way, and vaccines are the solution. And my argument is that although we've done really well here in the United States, it's still, the issue here is that we have less than 60% of the eligible population has been fully vaccinated. So we still have a while to go. And as many of you know, with regards to these types of viral infections, they need a susceptible host. 42% of the population is still susceptible to this virus. And so it will be something that we will see that is endemic. And so it's important to talk to people about this and not give them false hope. With that being said, as Dr. Dowdy mentioned, these layered strategies that we have been using this whole time, thinking about masking, thinking about social distancing, again, thinking about the ways in which we're mixing with people that might be vaccinated with those that might be unvaccinated, these are all going to help reduce your risk of exposure. So I would think about this as any other way that you think about any other pathogen, like a cold or a flu, for example. It's the same way that I would approach this. And the way that we can communicate this is that, again, again, COVID is here to stay. The great news is the game changer has been vaccines, because they've been able to essentially prevent severe COVID, i.e. hospitalization and death. And that's really what we need to be messaging around, that people can still get COVID, there can still be breakthrough infections. But the great news is, if you have been vaccinated, you are very much less likely, I think it's 12 times, to be hospitalized or have severe COVID compared to those that are unvaccinated.
Great, thank you. Dr. Dowdy?
Yeah, so I think as Dr. Limaye said, another way of framing this is that if you have been vaccinated against COVID-19, this is a disease that looks very much like the flu to you. It's something that can make you feel sick. It's not just an everyday cold, but it's not something that's likely to land you in the hospital or kill you. Though, of course, if your immune system is weak, you need to take some extra precautions. Everyone wants there to be a COVID end day, a day that we declare this pandemic is over. Nobody asks about when is the end of the flu, for example. This is a disease that's going to be with us for the foreseeable future. It's going to come and go. The question is, when can we get this to a point where it's tolerable to us as a society? And I think that we may be closer to that point than we imagine. If we already look at how we're living our lives today, as opposed to how we were living our lives a year ago, we've made great strides. So we're not at the pandemic end date, and we never will be. But we are making real progress, and I think there's a lot of reason for optimism going forward.
Great, thank you so much. Here's a question from Zach Stieber at the Epoch Times for Dr. Dowdy. Is herd immunity still achievable given the vaccine's waning effectiveness against infection? If so, how do we discern the proportion of the population that needs immunity? If not, what should be the goal in terms of the US response to the pandemic?
So I'm going to come out and say, I do not think that herd immunity, as people are conceptualizing it, is feasible. It is not. We are never going to get to a level of immunity in this population where this virus just disappears from the map. And so the question really is, how can we get levels of serious illness, people having long-term effects, being in the hospital, and in unfortunate cases dying? How can we get that to a level that we can tolerate as a society? And we need to be thinking in those terms, not in terms of how can we get to a point of zero COVID, because zero COVID is not going to happen.
Thank you so much. And for Dr. Limaye, what is the extent of vaccine hesitancy in the US? What populations have the lowest vaccination rate and why? Will those numbers ever go up? What would it take?
It's a really great question. And as I mentioned before, we still have a little over 40% of the eligible population, and this is excluding the 5 to 11-year-old cohort, by the way, that have not yet gotten the vaccine. And so I think what we are starting to see now is that if you have not gotten the vaccine, there's essentially two reasons why you will get the vaccine. So one is that you will see either a close friend or a family member ends up getting severe COVID and ends up in the hospitalization or passing. That has been one, I think, a nudge that has forced people to think about the vaccine decision. The second is mandates. That is one thing that we know will change vaccine behavior as we're starting to see different employers think about mandates. That is changing vaccine coverage in specific populations. With regards to where we are still seeing hesitancy, I think if you look at a coverage map and then you lay upon that infections, number of cases, as well as severe COVID, you will see essentially it matches up pretty closely. There are several states in the South that have lagged behind in coverage since the beginning of the pandemic. They continue to have severe COVID. So for example, I'm talking Alabama, Louisiana, Mississippi. In addition, we know that there are pockets in Texas. With regards to specific socio-demographics where we're seeing hesitancy, it tends to be individuals that tend to be white, that might live in more rural areas and tend to vote more more Republican or conservative. We're still seeing those. While we still have some lags and disparities with regards to individuals that identify as Hispanic or African American in terms of getting the COVID-19 vaccine, we have seen that those disparities have actually narrowed over the last year or so. So we still continue to have some issues with regards to persuading people to get the vaccine. And I think, again, the goal here is going to be to continue to be empathetic, to be compassionate, and to continue to have one-on-one conversations with these individuals, because it's important to not be dismissive of people's concerns. That's the only way that we're going to be able to nudge those individuals into vaccine acceptance.
Great, thank you so much. Here's a question from Emily Kopp at CQ Roll Call for both experts, and we'll start with you, Dr. Dowdy. Can you elaborate on whether the Pfizer and Merck antivirals are as big of a game changer as Twitter seems to think?
So I think if you have COVID-19, and especially if you have a weakened immune system or are otherwise at risk, these are a game changer. These are drugs that you can take. You don't have to get an infusion. You can go to your doctor. You can get a prescription and take these pills. And they, if they pan out to be as good as the data that Pfizer are presenting to us, they have a 90% chance of keeping you out of the hospital and saving your life. From a perspective of preventing transmission and the pandemic as a whole, these are not going to be a game changer of prevention the way the vaccines are. In terms of preventing people from ever getting the disease and transmitting the infection, vaccines are far and away our best tool and will remain that way.
Dr. Limaye?
I think it's really important to keep your eye on the prize when we talk about this. And what I mean by that is that it's important to not think about cases, but to think about prevention of severe COVID and death. And again, as Dr. Dowdy just mentioned, these antivirals will have a huge effect on severe COVID, as well as preventing hospitalization and death. And that really should be the metric that we're using to determine whether or not a therapeutic product is effective or not. Similarly, in the same way we should think about vaccines. We will continue to have cases, but we know by and large that these vaccines are highly effective with regards to preventing severe COVID, which is really what we want to do in the end.
Great, thank you. Here is a question from Saba Aziz from Global News Canada for you, Dr. Limaye. How important will booster shots be going forward? Will we need to take them regularly?
It's a great question. So the reason why we take boosters, and I think this is important to explain, is that vaccines, including the COVID-19 vaccine, but other vaccines, immunity starts to wane against that type of infection after a certain period of time. What I mean by that is that it's important to get a boost to the immune system, to remind your immune system that this is a pathogen that you may encounter, so that when you do encounter that pathogen, your body is ready to fight it. Right now, what we're seeing in the recommendation, I believe, is coming down the line very soon, that all adults should be getting a booster 6 months after if they got an mRNA vaccine. And I believe it might be at least 2 months after the Johnson & Johnson vaccine, if that's what you received. And the reason is to do that is to, again, just boost the body. It'll be interesting to see moving forward whether or not this is going to be recommended on a seasonal level, like we do the influenza vaccine, or if this is something that we're going to have to look at transmission to essentially see what community transmission looks like with regards to whether or not we're going to need a boost. So I think time will only tell. And again, as Dr. Dowdy mentioned, I think there may be a bit of a surge in the winter, but it will be interesting to see around what sort of severe outcomes occur in relation to that surge, specifically compared to last year, because of the amount of vaccine coverage that we have. So it's going to be a number of factors that will really inform us whether or not we will need an additional booster after this recommended booster is done.
Great, thank you so much. For you, Dr. Dowdy, a question from Joe Lawler at Portland Press Herald. What do you make of the northern New England surge in cases in Maine, Vermont, New Hampshire? Do you expect the surge to continue all winter? After the wave subsides, will high vaccination rates in New England finally tamp down infections for a longer time period?
So this is a great question. And again, I have to caveat anything I say with no one can fully predict the future of this pandemic. But what I think we're seeing in New England, which is very similar to what we're seeing in Europe, is that there are pockets of individuals who are either not vaccinated or who have been infected or vaccinated a fair amount of time ago, to where immunity against infection is a little bit lower than it used to be. I do expect that we will see an upsurge in cases over the winter, but this does not have to translate, as Dr. Limaye has been describing, into increases in deaths and hospitalizations. So I think it's hard to predict for sure what's going to happen in the future, but I do think that we are likely to see some increases in cases, but nothing near the level of serious illness and mortality that we've been dealing with over the past 2 years.
Great, thank you. Another one for you, Dr. Dowdy, Julie Steenhausen at Reuters. The messaging around booster shots in the US has been focused on preventing transmission by boosting antibody levels. Is this a valid strategy for vaccines that are not mucosal vaccines?
So I think that these vaccines and these boosters do boost antibody levels. I'm not sure that I would message this as a strong tool for preventing transmission. I think that among people who have gotten booster doses, we will see lower cases and less transmission, because you can't transmit COVID if you don't get sick. But that being said, the primary source of transmission remains people who have not been vaccinated. And so in terms of the number one priority for reducing transmission in this country and throughout the world, this remains getting people their first vaccine series.
Great, thank you so much. And for you, Dr. Limaye, what would you say to a parent who is hesitant about vaccinating their child?
You know, it's a challenging question. And as a mother that has 2 kids under the age of 12, I feel this pain. I think that it's important to think about the risks and the benefits of the vaccine. One thing that I will say, if you look at what the American Academy of Pediatrics have said and the CDC have said, when you think about any sort of therapeutic product, right? If a doctor says to you, I recommend that you take a blood pressure medication because your blood pressure is high, that's because the benefits outweigh the risks. We know that there are risks related to blood pressure medication as well. Vaccines are no different. So when a recommendation does come out that kiddos between the ages of 5 to 11 should get the vaccine, that's simply because we know the benefits outweigh the risks. While we know so far, generally here in this country, children have had less severe COVID than adults, for example, we still do know that children have died of COVID and have had severe COVID. The other thing I would say related to COVID from a younger age cohort is also thinking about the unknowns related to long COVID. We're starting to explore this. There was a new study that just started that will track prospectively moving forward long COVID in young adults, but we don't know enough about how long COVID affects brain development. And so I think it's really important for parents to be able to make an informed decision, to think about the ways in which they're engaging or working with other people that might be vaccinated or might be at higher risk, for example, and to think about the ways in which they can continue to make sure that their child is able to developmentally and socially flourish, whether that means keeping them in school, therefore getting vaccinated and whatnot. And so I understand, and I know it's been a long haul and there's been a lot of information, and I think parents have had to deal with a lot of uncertainty. But again, my biggest recommendation is speak to someone that you trust so that you're making an evidence-based decision as to whether or not to vaccinate your child.
Great advice. Thank you so much. And the last question, it's a follow-up from Julie Steenhausen at Reuters for Dr. Dowdy. Given that some people will never get vaccinated, what role does natural immunity play in reducing the burden of disease in a community?
I think it's important for us to be honest that infection with this virus, if you survive, you do have some level of protection against getting infected in the future, and particularly against getting serious infection in the future. Our immune systems are designed to prevent repeat infections from being as severe as the first infection. And so I think that there is an important level of protection that is afforded by previous infection. It's important to note, though, that even those who have been infected in the past get additional protection from being vaccinated. So just because you've gotten infected in the past is not a reason not to get vaccinated. These vaccines provide protection to all people, previously infected or not.
Great, thank you so much. Thank you to Dr. Dowdy and Dr. Limaye for your presentations and insightful answers. We will email the links to the resources mentioned today and shared in the chat. And with that, I'd like to say thank you again to everyone for joining us today.